A hearing on military suicides was requested by Senator Inhofe several weeks ago, and we all appreciate that request. Due to our committee markup schedule, we were unable to schedule a hearing until this week. Originally, this hearing was meant to focus on service suicide prevention policies and programs. But given the recent disconcerting reports alleging poor diagnosis and treatment of service members suffering from traumatic brain injury and post-traumatic stress, I felt it important to broaden the scope of our discussion today to include those topics as well.
Senator Inhofe, who initiated a request in April for a full committee hearing on the tragic and important issue of suicide in our military, and I'm very pleased and thank you for your initiative, Senator Inhofe. I'm pleased that we've got having this hearing.
It was called to my attention, it's oddly enough, of all the subcommittees of the Armed Services Committee, the one I've never served on is personnel. I don't know a lot about these issues, but when it was called to my attention, the propensity of these suicides, and we started looking into it, I made the request, Mr. Chairman, and also the request, which I think you may be doing in another hearing, actually bringing in some of the medical experts and soldiers with their experiences. General Corelli, I know that you have really made a study of this thing, and you said something to the effect that I didn't see, it wasn't told me, it was in your written testimony, that on active duty, you've actually had a reduction, but an increase in the reserve component. Is this correct?
That's correct, Senator.
Well, you know, what it just seems to me, and I can remember back during the 90s when we were downgrading the size in the military and all this stuff, then of course when 9/11 happened and we have all these deployments, we hear, everybody up on this side of the table, hears from our people back home, our Guard and Reserve, the op-tempo is just not livable, and that goes all the way across services. And I would think that since you made that statement, that perhaps the op-tempo might be some leading cause of these, in that the op-tempo for the Reserve and the Guards is much higher. Do you see that relationship?
I see that as one of the factors, Senator. We've had an increase, and it's really interesting. We've had a decrease of 15 active component suicides this year compared to last year. And I will tell you, when I talk active, I'm talking about the 547-4 we've got in the active component force, plus about 200,000 that are mobilized at any one time out of the Reserve and National Guard. So it's about a 700,000 person force. So once a reserve soldier is made an active duty soldier, he is counted in my active component numbers, and we are down 15. We are down 2 with our reserve component soldiers not on active duty. We are up 21 in our National Guard soldiers who are not on active duty. And that concerns me greatly. I think it's 3 things. I think it's multiple deployments for them. I don't think we're getting enough time with them at the demob station to give them the kind of checkouts they need, behavioral health checkouts that they need. And third, I think Senator McCain said it in his opening statement, this lack of human interaction, at least with other soldiers that they have when they leave the service within 5 to 7 days after a 12-month deployment, I think is a real issue here.
Yeah, well, that is op-tempo. That's what we're talking about. And there was an article, and perhaps you had implied that on the public radio thing that was not totally accurate, and I agree with you. There's another article just on the 14th of June in USA Today that talked about, and it was pretty critical because it talked about the law that was passed in 2008, and one of the main persons was this Representative Bill Pascrell of New Jersey, which said there have to be both pre and post, and apparently we're short on the post end of it. Can you elaborate on that a little bit?
Senator, we followed the law when it was passed, and the law stated that we were to use the ANAM as a screening tool in pre and post deployment. We still use the ANAM in pre-deployment to get a baseline on cognitive skills of our soldiers. But what we found when we used the ANAM in post was that we were getting a number of false positives, a high number of false positives, way too high. And we were tying up our limited behavioral health specialists in working their way through these false positives from the ANAM. Now, we still use the ANAM in post if a soldier demonstrates any of the symptoms of TBI or any cognitive issues. So we are still using it. We're just not making it mandatory for every soldier, so we don't take our short behavioral health specialists and wade through a whole bunch of false positives which the test tended to produce. We have other things that we're using. Virtual behavioral health is something I'm very excited about, where we can give every soldier a 30 to 40-minute triage session with a behavioral health specialist using the internet, using virtual, putting together a virtual net of providers who can take an entire brigade and put everybody from brigade commander to the youngest private in that unit through a 30 to 40-minute screen. I mean, this is the kind of thing I would like to be able to provide to reserve component soldiers when they get back, but I don't necessarily have the time necessary to do that.
Yeah, well, I really appreciate the attention you've given to this issue. Any of the rest of you want to comment on that in terms of how it relates to the law that was passed in 2008 in our authorization bill?
Senator, if I could, I would say that we still use the ANAM pre and post. We're fortunate in a way, based on the numbers that we're dealing with, that we can do that even with the false positives. Like the Army, we also have other tools that we use, a fair amount of success with a post-deployment health assessment, which takes place in theater, face-to-face, or shortly after return. One of the things that I think is very important is 6 months later, there's a post-deployment health reassessment. That assessment has yielded 16% of those airmen that we're treating for post-depression or post-deployment stress syndrome. So we think that 6-month follow-up is extremely important as well.
All right.
Senator, we are in agreement with the Army and the other services here. We test, using the ANAM test, 100% of our Marines prior to deployment. We are not doing that when they come back. It is used occasionally by our mental health professionals if they don't have anything better. But the issue of false positives and the lack of reliability in the ANAM on the post-TBI incident, especially when you come home, leads our Navy doctors, our mental health professionals, to seek other ways to take a look at our Marines. And we're doing that. And much like General Chandler talked about, we screen both those Marines, 100% of the Marines as they're coming out of theater, and then within 90 to 180 days later, we do it again. And just to give you some numbers, for our PTS, 15% of those that are screened coming out of theater answer some questions positively, which would lead you to further screening. And of that further screening, 7% see mental health professionals. And then by the time you winnow this thing down, it's about 2% of the Marines actually need mental health care when they come out. So right. It's just not that reliable on the backside.
That's very helpful. I appreciate that. My time has expired, but I want to ask a question, just could be answered for the record, if that's right, Mr. Chairman.
Yes.
And that is the article, another article, it was January 14th, when soldiers deploy, family deploys. It's talking about the tying in the op-tempo with the families, with the deployments. And apparently there was the New England Journal of Medicine did a study that I read this article and then did a little bit more research on it, that some of the findings that they're having in terms of the families, the wives, the kids, and nothing was really said during the opening statements about that. So I'd like, for the record, to have the four of you address what we might be doing in terms of the wives, the children that might be having the same problem and the same ratio that the troops themselves or the actives in the reserve components are having. If we could do that. Thank you, Mr. Chairman.
Thank you, Senator.